And so we want to talk about this with right now an expert, Dr. Rashir Gupta. He's the founder of Mountain View Headache and Spine here in the Valley, 3 locations around the Valley. We want to first talk about how to reduce heat-related migraines. And I was asking you, is there a correlation between extreme heat and the cause of a migraine, or is it if you're susceptible, the heat can bring it on?
Well, the reality is, and thank you for having me on, the reality is that, we call every bad headache a migraine, and not every bad headache is a migraine. Yeah. So I can tell you that extreme heat can cause dehydration, and that can definitely cause an extreme headache, which feels like a migraine. If you are a migraine sufferer, changes in barometric pressure, such as a little dampness in the air, can dramatically increase the intensity of your migraine. Mm-hmm. And so a lot of people here actually live here because of the dry heat. So the minute you have a little bit of dampness, which often happens every time we have a big heat wave, your headaches get far worse.
For people who say, I'm so prone to headaches during the heat, is it actually the heat or is it the dehydration, the lack of water?
It's really the lack of water. As long as you stay really dehydrated, you're getting maybe IV vitamin infusions, IV hydration, you're drinking a nice electrolyte solution, you can really brace the heat. The heat itself is not the problem, it's what the heat does to your body.
Yeah. We have hundreds of heat-related deaths every summer, sadly. And we had the most indoor heat-related deaths the last 2 summers. Is the primary cause, obviously it's dehydration, but then is it stroke? Is it heart attack?
Right, so you're not getting enough blood to different organs because there's not enough fluid in your system because you're sweating it off. So it could be a stroke, it could be a heart attack. I think in the Valley, most likely a heart attack is what's going to cause it. It can be what we call shock, when your body is just not getting enough fluid to all of its different organs. And that's really what causes these deaths.
And we've talked about the need to maybe think of heat as drownings, where if you think that someone could be at risk, maybe a neighbor, someone who's elderly, maybe they don't have air conditioning, be aware, make sure you get them in cool places because there's so many different potential health hazards. First sign that someone may start to feel something and they should act.
Well, I'll tell you this, when you have a heart attack, I know in movies we always hear people grabbing their chest, but the first time you have a heart attack, it'll actually feel more like a shoulder pain. And that's because our heart isn't used to hurting, and the pain fibers that go to the heart also go to the shoulder. So the brain thinks that, it must be my shoulder hurting because my heart never hurts. So if someone's saying that they've been having difficulty with the heat and their shoulder's hurting, that might mean that they're having a heart attack.
Yeah, okay. Well, thank you so much again. We really appreciate it. Let's make sure we take care of ourselves and take care of those around us. Be aware this time of year. Again, Mountain View Headache and Spine, 3 locations around the Valley. We really appreciate you, Dr. Gupta, coming in and providing your perspective.
Thank you for having me.
All right.